Hey guys, Ian Salmonsky here, co-founder of Elite Living, and I have here with me our lovely nurse practitioner, Sarah Soeum. And I just wanted to touch base today. We're going to talk about a couple different medications. But yeah, welcome to the Elite. Let's get started. How you doing today?
I'm doing well. Thank you for having me.
Yeah, no problem. So, you've been with us for, about a month now or 6 weeks, since we've been getting off the ground running. She's been seeing a lot of patients, doing a great job helping people. And one of the medications that you actually took a big interest on was Armour Thyroid, right?
Yes.
You want to talk a little bit about that and, how you feel about Armour Thyroid?
Absolutely. First of all, the endocrine system is very complicated. Part of the endocrine system is the thyroid, actually a very important part of our system. In fact, we have like trillions of cells, and all of them require T3 and T4, and actually there's T1 and T2 and the calcitonin. So we're finding that as we're aging, and there are lots of different factors that cause thyroid problems. Commonly the hypothyroid, and then there's hyperthyroid. Now without the proper amounts of T3 and T4, we're not functioning properly. So basically, one of the main functions of thyroid is to control metabolism. So it works like, it controls our temperature, but it controls metabolism in all the cells. Without it, we're, in hypothyroidism, we're experiencing fatigue and brittle hair, skin and nails are thinner, more brittle. It also affects our mood. So Armour Thyroid in particular is, they call it NDT, that's a class of medication.
So NDT stands for non-desiccated thyroid, okay?
Right, and desiccated meaning it's been dried and then compounded and created into the medication. But it does come from a pig.
Yeah, typically it's a pig, sometimes a porcupine.
Right, so there's an animal base component. We also do have medications that are outside that are not animal based.
Yes.
But in particular, Armour Thyroid is, so that's something to know. But in most cases, it's very effective, more effective than using Synthroid, because Synthroid is just a synthetic T4. So patients are reporting that they are feeling better when they go on Armour Thyroid. They're losing more weight, and women seem to respond a little bit better to, right. It isn't necessarily the right medication for everyone trying to switch from Synthroid to Armour. However, the data has shown that it is effective, and women or people in general are feeling better on it.
Basically, what she is saying there, so Synthroid is T4, the T4 hormone. So our thyroid, located in our neck, okay, that produces T3 and T4. Those are the two predominant hormones that help us feel better, helps with metabolism, our mood, our cognition, our focus, our body temperature. If you've ever been that person in the room that is the only one wearing a sweatshirt in situations where it's normally hot, chances are you have some sort of, I don't want to say thyroid condition, but it's, unoptimal thyroid where it could be functioning a little bit better. And that's why you sort of feel like you're the only person in a hoodie in the classroom. Now, Synthroid, being that it's T4, eventually will convert into T3. So what they used to do before the NDT was being used, non-desiccated thyroid or Armour Thyroid, they would give you your Synthroid dose, and eventually it would convert into T3, and they sort of would wait for all of that to happen, and they would monitor how you're feeling, or weight gain or weight loss or things like that, and they would take all of those different types of symptoms and then play with your dose, go up, go down. Sometimes you're on 88 micrograms of Synthroid, or go up to 100, or that's too high, you go back down, and it's a constant battle. You're going up and down and up and down. So the NDT, the Armour Thyroid, has multiple grains, but it has both T3 and T4 in it. Because recent studies have shown that when you're getting that T4 hormone and it converts into T3, your natural T3 stops producing the correct way. And so when it stops producing the correct way, that is the faster acting of the two hormones. That's the feel-good hormone. So then you're not getting the right dose of that T3 hormone. So when you do that NDT, when you get both doses, now you're getting a constant cycle of both of those, and it makes you feel a lot better and a lot quicker. And yeah, women tend to feel a lot better, a lot sooner, more so than men when it comes to this thyroid.
Right, right. And I just wanted to add, also there's something called the reverse T3. Yeah. So, a lot of times traditional endocrinologists don't even look at the full panel and don't see that full picture because essentially the reverse T3 does nothing for the body, and it will bind to the cells because it's so it's similar to T3, but it's not active. Yeah. So it doesn't do anything. But with the Armour, you're getting the T3, you're getting T4, you're getting, like I said, T1, T2. You're also receiving calcitonin and the other enzymes that come from the actual thyroid. So it's quite beneficial, and we want to look at how somebody responds and how they feel, because that's really the most important, is Absolutely. That they're actually feeling better and losing the weight and, in a better mood. So
yeah, so this is also another way that we're helping treat the individual holistically, from point A to point B, looking internally, seeing what's going on. It doesn't necessarily mean that they all have a thyroid condition, but their thyroid's not optimal. It's not functioning the same way that it once did. So this is an opportunity to be able to help with all these other types of symptoms, and weight loss can be one of the side effects of that, which a lot of people are looking for, obviously. But yeah, I mean, this is a good way to help. Now, you mentioned reverse T3. So that's part of the labs that we do here at Elite Living. Other labs that we do are TGAB, thyroglobulin antibody, and then anti-TPO. So both of those actually will tell us if a patient is, because we hear a lot of hypo or hyperthyroid, which you had mentioned earlier. Mm-hmm. And a lot of times since I've started Elite and other companies have been in this field, I've noticed that people who say or were diagnosed by an endocrinologist at some point that were hyper or hypo, they ended up having some type of autoimmune disease. Which would be either Graves' disease or Hashimoto's. So all those labs help us depict whether or not someone is having an autoimmune flare-up, which brings me to the next medication that I wanted to talk about, and that was naltrexone. Right. So naltrexone is an FDA-approved medication, but for alcoholism or drug abuse at high doses, okay? It's been used for over 30 years now at low doses for autoimmune stuff. So Sarah's going to give us a little brief synopsis on the method of using low dose naltrexone and what exactly is it, and we'll be able to talk a little bit more and have a little bit more insight on that.
Yeah, so just start with a little bit of history with the naltrexone. Like Ian said, it is an FDA-approved medication for opioid and alcohol dependency. It is common to, or same chemical structure as Narcan. So that's, but it was FDA approved in the mid-1980s, and they used it in doses of 50 to 100 milligrams to treat alcoholism and opioid dependency. Very effective. But I think it was a doctor here in New York that decided he was working with a lot of AIDS patients, and his study was he was giving it to the AIDS patients who had the low CD4 counts, and he found that it was actually very beneficial to them in helping their immune system. So then, and in low doses. Yes. So then they started giving it to people off-label. For autoimmune diseases. So, in particular with Hashimoto's, the naltrexone is used starting at a very low dose. Sometimes
usually it's like 1 milligram.
Yeah, Yes, and it has shown to just lower the inflammatory process in the body, and and along with, I mean, I just kind of going off topic a little bit, but with Hashimoto's, it's autoimmune. It's affected by food.
Yeah.
And could be toxins from the environment, but in a lot of times we tell people to stay off of gluten.
Yeah, so
Yeah.
gluten, nightshades, those are all
Yeah.
very inflammatory foods for people who have any type of
Autoimmune.
thyroid function or autoimmune disease. But yeah, go on.
Right, but the naltrexone, because it works to bring down the inflammation in the body, it's become very effective. How it's given is you take it at night, and it basically blocks the binding of the pain receptors. And so taking at night allows it to sort of because the half-life is pretty short, but it allows it to work effectively. So I think between 3 and 4 a.m. is when our endorphins start. We get a bit of an endorphin rush. So it blocks the binding of the pain receptors, kind of coincides with when our endorphin rush begins in the body, and then it gives you like a release of endorphins as medication is starting to work. And that is how it lowers the inflammation in the body, basically.
So when you're taking that, so when she's saying that it's lowering the inflammation in the body to the receptors, so essentially a lot of times when people have or were diagnosed with some of this, they'll still do the typical, Synthroid type prescriptions or medication or things of that nature, but they're not actually treating the autoimmune component of it. So this off-label use will put that autoimmune, it takes time, it takes like a year, I think, but it will put that autoimmune into remission, but I think you still have to use an NDT, or at least we would use an NDT to treat the thyroid function of it all, while also using the naltrexone to put that autoimmune side into remission as well.
Right.
Correct?
That's right.
Okay.
That's
yeah.
right.
No. So you would use both, and doing both of them. This way, you won't have that yo-yo effect of trying to adjust the doses all the time. You'll be treating both things individually to help you feel better. And again, this is another way here at Elite how we just like to be able to treat the individual as an individual, holistically and systemically.
Right, and effectively.
Yep, exactly.